So next we are having it from, next question is from Asha. So she's telling, my sister is diagnosed with a stage 2 breast cancer. What are the standard treatment options available at this stage? Does the age of the patient matter
Okay. I
in
think
the
age is
effectiveness of the treatment? Yeah.
Did she say the age in this particular situation? Do we have her age?
Yeah, she has mentioned here 30.
I'm sorry. Okay, I didn't get this. So, yeah, 30-year-old female with stage 2 breast cancer. This is these. I'll be open. Like generally, younger women tend to have a more aggressive, faster cancers than an older female. Uh, the things we look at are like what is the hormone receptor status. If there's a tumor cell, the cancer cell express a estrogen receptor, progesterone receptor. Does it express HER2 receptor, which is a growth factor receptor? These are all the things that are on the proteins that are present on the surface of the cancer cell, and they drive the cancer growth depending on what external stimulation they're getting. It's like a cancer signaling that happens based on the presence of these receptors. So, in a stage 2 young female, if they have, for example, triple negative, which means all these receptors are absent, they may require chemotherapy. Um, you know, it could be like 4 cycles, or it could be like 12, 18 weeks of chemotherapy before proceeding to surgery, where you shrink all the cancer and then take to surgery and remove the lump, remove those lymph nodes, and additionally give radiation. Now, if it is hormone positive cancer, like a small one, stage 2 small cancer, they could actually go straight to surgery and then offer radiation and hormone blocking therapy, like we call them anastrozole or letrozole, which block hormone production. Now, I'm going to back off that. Actually, we use tamoxifen in younger patients. The other two I just mentioned, letrozole or anastrozole, those you have to block the ovaries also to prevent them from producing estrogen, progesterone. Because these cancers, if they are estrogen positive, they have the estrogen, progesterone receptor. They are feeding on the hormones. They are growing because of the presence of those hormones. So you have to block those hormones and then prevent the cancer cells from coming back. A little bit into this, we discovered HER2 receptor around 1995, 2000, around that time. And we have drugs called Herceptin. I'm sorry, like trastuzumab would be the generic name of it. Trastuzumab and certain antibodies which can actually go and attach to that receptor and cause cancer cell death. So by doing that, we added like about 20% success rate. So these are all the things that come into play when you're dealing with whether it's stage 2 or stage 3 breast cancers. What's new? We are now actually what's new is like we're now even using immunotherapy. There's a score called PD-L1 score, which is calculated on the cancer cell in women who are triple negative without any receptors, young female. In those patients, you can also add immunotherapy, where you can make your own white blood cells or T cells attack the cancer cells in addition to the chemotherapy. And that has shown to improve survival rate. And that's more and more upcoming. It's very much used in lung cancers, kidney cancers, bladder cancers, some of the colon cancers. Actually, a lot of cancers. Immunotherapies have been used. We are using that in breast cancer too. So that's a very broad question for me to answer. That's why when people say like, hey, how do I treat this cancer? I'm going to say, okay, what cancer? Is it this one, that one, that one? What is the hormone status? What is the PD-L1 score? What is the size? What is the lymph node status? Did we do a PET scan? By the way, I didn't talk about PET scan. So did we do a CAT scan? Did we do a PET scan to make sure the cancer has not spread to other organs? So it's a very long consultation.
Okay.
Yeah.
Okay. So thank you for that detailed explanation.